Hello friends, on behalf of Testncal laboratory, I am Amit Pathak, presenting a presentation of the testing and calibration services which we provide for hospitals, clinical and biomedical instrument and radiological instrument. Our laboratory is located in India and subcity of New Delhi in Dwarka, and we are NABL ISO 17025-2017 accredited laboratory. We are also ISO 9001-2015 accredited. For biomedical instrument, we are not accredited as per ISO 17025-2017 as yet. Till now, we are in process of that. Basically, the main objective of testing and calibration of hospital clinical instruments is to maintain the quality and the accuracy of the instrument at all the time for a hospital or in any clinical or activity. Why testing and calibration of hospital? There are the reason why it should be a clinical practice need to be calibrated or to be tested of biomedical instrument. So few of the reason is, first of all, increase the accuracy of instrument. Calibration shows it gives you the result how instrument is behaving. So if the instrument is not behaving properly or not obtaining the results as it is desired or it is desired by the manufacturer, so you will be able to know what percentage of accuracy it is working. So you will have the while you are collecting the clinical data or treating a patient, you must know your instrument is how much accurate for the treatment. Reproducibility and repeatability. Reproducibility and repeatability is the sense that we should do the calibration and testing in phase manner, so the duration of the equipment could be enhanced. So and it can be used for a prolonged time. As we all know that the clinical or biomedical instrument is highly in in cost, and it's very difficult to some of the rural and suburban areas where that equipment is servicing and equipment spares is not available for them, prolong your downtime of the equipment. So to enhance the capability of the instrument for prolonged use, calibration is only the solution. Long life of instrument, that same long life, whenever you will do the calibration activity, you will know the actual aspect of the instrument, actual behavior of the instrument. So you can on that basis you can decide how much activity we are performing, and usage can be enhanced. Uniform performance of equipment. So the uniform performance of the equipment can be monitored while doing the calibration. Superior quality of healthcare services. In clinical practices, the healthcare services depends upon the various biomedical instruments. So the calibrated or traceable instrument and traceable calibrated instruments required to be calibrated in a specific interval or time as per ISO IEC, not ISO, it is IEC 60601. On that basis we used to do the calibration. Enhance patient confidence. So once your equipment is calibrated, then the clinical practice will be also confident, and the patient which is his life is on danger or under treatment will also have more confidence on the equipment. Mandate for accreditation process for NABL, and it is all the this thing is all the accreditation body like NABL, NABH, it is required that all the instruments should be calibrated before it goes for accreditation process. Sorry. So services we provide instrument calibration as per NABL, NABH requirements. We also provide the calibration and QA testing of radiological instrument as per AERB guidelines. For India, it is Atomic Energy Regulatory Board guidelines. It is AERB guidelines as per AERB. NABL, NABH approval consultancy service we provide. AERB ALORA consultancy services for any radiological instrument which is working in India for clinical practices, that has to be updated and that has to be on the ALORA portal of the Government of India and Atomic Energy Regulatory Board, AERB. Biomedical instrument mapping and maintenance services, we are also mapping the instrument and we carry out the maintenance activity also. Maintenance activity, preventive maintenance and seasonal or timely maintenance, we say. Key parameters for testing and calibration of biomedical instrument. So mostly few of the biomedical we have taken on this slide, few of the biomedical instruments like defibrillators. Parameters we do: electrical safety test, it is EST, biophysical energy measurement, ECG performance and arterial simulation, charge and discharge time test, waveform simulation. The second is pulse oximeter for electrical safety test, O2 oxygen saturation, heart rate, pulse amplitude and single selectable pigmentation and ambient light condition. Infusion pump, widely used in the clinical hospital and clinics. So electrical safety test, flow rate, occlusion alarm test and pressure of the flow. Another the vital this thing device is a patient simulator, and it have multi-para monitor, we are saying it. It is electrical, we do EST, that is electrical safety test, ECG, blood pressure, cardiac output, respiration, temperature and pacemaker recognition. So we in multi-para monitor we do kind of 7 tests during its calibration. Another one is ventilator, very vital clinical instrument. The life of the risk patient is maintained on this instrument, so that there is a very critical instrument. And the test we perform is EST, tidal volume, respiratory peak, inspiratory peak pressure, IE ratio, oxygen level, inspiratory hold, etc. And also one, I think I have missed the electrical safety test, that is paramount. The fatal monitor. Fatal monitor is in fatal monitor we test electrical safety test, fatal ECG, maternal ECG, uterine activity and TOCO simulation. Why Testncal laboratory? Testncal laboratory is NABL accredited as per ISO IC 17025 2017, ISO 9001 2015. QA testing facility is also available with our sister concerned lab, concerned lab. So we are doing QA testing of all radio diagnostic instrument as per AERB guidelines. High precision master instruments. We keep all the, for testing and calibration, we keep highest level of accurate instrument to calibrate the master equipment to calibrate the biomedical instruments. All testing and calibration procedure as per US FDA and ISO and IEC and NABL guidelines. High experienced engineers, all the engineers having the experience of more than 5 years to calibrate the instrument at various locations in India as well as abroad. One-stop solution for your testing and calibration requirement. We have a wide range of scope. As we say in early presentation, we don't have till date, we don't have NABL scope in biomedical. We are on process of getting the NABL scope as per 17025. Pan India presence. We are located right now in our headquarters in Delhi. Our other locations are in Ahmedabad, in Bihar, and in Guwahati. Out of India, we have branches in Nepal, Bangladesh, Bhutan, and Indonesia. Free training and guideline for operator. We also trained the operators who operate the instrument, biomedical instrument in hospitals. We tell them, suggest them which thing has to be to improve the accuracy and prolonged usage of the instrument, biomedical instrument. Clients list, as I suggest, more than 35,000 instruments we have calibrated, and it's going on. Most prestigious hospitals like Safdarjung Hospital, Bankura Medical College, Maulana Azad Dental Services Delhi, Jabalpur Hospital, and many more. BBR Medical College Gorakhpur, we have done the calibration activity. So for any concern, any details, you can contact us with the contact details. Our contact details are given in the list. So thank you all for this kind support and for your presentation, and I will be very thankful for your for your kind attention. Thank you. Thanks a lot.